664 billion naira. That's the figure spent by Nigerians annually on medical tourism. This is from official government sources and is just 162 billion naira less than the 826.9 billion naira federal budget for the health sector in 2022. It tells a story of the rising number of Nigerians who opt for medical treatment abroad, a confirmation that all is not well with the country's healthcare delivery system. For many years, the health sector in Nigeria has been grappling with a number of challenges, ranging from poor funding to inadequate manpower, worsened by the recurring problem of brain drain in the sector. A WHO report reveals that Nigeria has a doctor-patient ratio of 4 doctors per 1,000 patients and 5 hospital beds per 10,000 patients. While this is a widespread problem that cuts across all cadres of the health workforce from nurses, pharmacists, radiographers and others, the situation seems not to bother those in authority. Critics have highlighted that it betrays a lack of commitment on the part of the ruling class, starting from the president, who since assuming power in 2015 has visited the United Kingdom countless times for his medical needs.
We were looking for a president who was going to come and review the hospitals and also give confidence to this personnel aspect and other substructures of the system and give it some level of confidence, as it were. But years down the line, we have a situation whereby the president is actually seen to go on medical trips as many times as possible.
The situation is not different at the state level. Health is under the concurrent list, meaning that state executives have the responsibility of providing meaningful health care within their state. But evidence shows that most of the governors cannot even use the public health facilities in their states. Incidentally, the medical trips they embark upon are funded by public money. Just last week, the embattled governor of the central bank, Godwin Emefiele, wrote to the House of Representatives that he cannot appear before it because he was on a medical trip abroad.
The governor is out of the country on official engagement, as well as attending to some health challenges.
A former Deputy Senate President, Ike Ekweremadu, and his wife are currently facing trial in the UK after being arrested on organ transplant and human trafficking charges. They were siblings seeking a kidney transplant for their sick daughter in a London hospital, a procedure that could have been done locally if the governing class, which he has been a part of for many years, had fixed the health system. The situation has grown from bad to worse, as each year thousands of trained medical personnel leave the country to practice abroad. Those left are also planning to leave. In 2022 alone, over 4,000 doctors and thousands of nurses, as well as 500 radiographers, are recorded to have migrated. The reasons range from poor remuneration, lack of basic medical equipment, inadequate investment in healthcare, limited opportunities, and general frustrations with postgraduate training.
You want to go to a better terrain where you're being regarded as a human being and your job is being valued.
At the rural level, where primary healthcare is a necessity, there have been greater focus in the outgoing year on how to revamp PACs to enable it to respond to common diseases, and especially maternal and child care, but without much traction.
The issues I have are with the politicians and the technocrats who are supposed to be managing the ministries of health and rural. People need to invest in primary health care. Without a primary school, it's useless building universities.
How many staff are on the payroll, not on the list of health workers? Then you will see that in a PHC that should cater for 10,000 people, we have, well, like we said, maybe 3 people that have clinical experience.
For experts, one way out of this is for government to implement the tax shifting policy.
Surprisingly, the governor tells me there's no clarity on the tax shifting policy. Mr. Governor, do you want universal health coverage in your state? Yes. The federal government Ministry of Health has given you a framework. Build what can work for you and don't blame it on the policy that's not working.
The outgoing administration seems to be taking late steps to address some of the problems. For the first time, the budget allocation for the health sector in 2023 hit 1.17 trillion naira, representing about 5.75% of the total federal budget, and a significant increase from the 2022 and 2021 budgets. However, it still fails to meet the 15% African Union benchmark agreed to at the Abuja Declaration 20 years ago. While it is a step in progress, similar commitment in state government budget is critical to balance out the efforts at the federal level. This is perhaps one of the most important demands from the political class struggling to attain political power as the country enters a democratic transition in 2023. Ogom Ezedimbo, AIT News, Abuja.